Greetings, everyone. My name is Davina Liggins, and I'm with Healing Made Whole. It is a company that I started to provide some knowledge and understanding to the general public about the power of choice and how we can use our choice to build a lifestyle that fosters longevity, health, and balance in the body. And today, I want to talk about vitamin D. Vitamin D is a fat soluble hormone that regulates over 1,000 genes. It is synthesized in the skin and it must further be metabolized to its active form in the liver, then in the kidney, and it also can be activated within immune cells. And most of us are familiar with the role of vitamin D in bone formation, but it plays so much more of a critical role, or all of that's critical, but it also has a critical role in modulating cell growth, neuromuscular, and immune function. And also, vitamin D is known to be anti inflammatory. So, any disease that has inflammation as the underlying basis, vitamin D is critical. For example, vitamin D has been administered to cancer patients and it's been shown to, in some cancers, to decrease metastasis and improve survival. It also has been linked or correlated with heart disease and type 2 diabetes. Now, I want to take a moment to pause on the lessons that we learned about the role of vitamin D in COVID-19. This is very important because we're all very familiar with this disease. Dr. Seheult from MedCram, he has a fantastic YouTube video that describes the correlation of vitamin D levels and COVID survival and even infection. And basically, those with suboptimal levels did not fare too well in terms of survival. Those with normal levels, or what was defined as normal levels, had much higher, almost 100% survival. So there's a strong correlation there in vitamin D. Now, he also poses, I'm going to provide two links in the description box. He also proposes that it may or may not be just vitamin D, that it could be other components, healing components that the sun has to offer to us that can also contribute to that survival difference that was seen. Because what they show also have started realizing that if you give large doses of vitamin D during the course of COVID-19 disease, it didn't alter too much the course of their survival. So it could be something else. It could be just not giving enough vitamin D, or it could be giving it too late. So look at his videos. I'm not going to go into too much more detail on that simply because he does a phenomenal job. That's Dr. Swell of MedCram. I also would like to highlight Dr. L. Ray Matthews. He is a former trauma surgeon. And what he showed is that vitamin D is very important for health. And particularly when he was a surgeon, he used vitamin D in his supplementation in his patients to help support their recovery. He saw that it was essential, very important. He also used vitamin D to help reduce the level of pneumonia in his trauma center. He also talks about, him and Dr. Swell also talk about the high frequency of low vitamin D levels often seen in African Americans and how it's so important that we get our levels up. So I'm going to link these videos. And I chose these videos because it's very relevant to COVID-19, and that's very fresh and real in our minds. So take a look. I'm not going to say too much more about that, other than that both of those videos, or all three of those videos, highlight the importance of getting vitamin D into optimal levels and getting out into the sun. So I want to next discuss what are the levels of vitamin D that we need. And what I mean by is the levels found in our blood. You will find that most sources will say that 20 to 40 nanograms per ml, or even 30 to 50 nanograms per ml are normal levels of vitamin D. However, Dr. Swelt, what you will find in his video, he offers something a little bit different. He says that optimal levels are 51 to 70 nanograms per ml. I told my family, make sure you're above 51 nanograms per ml. The upper limit is 100 nanograms per ml. Regardless, we should all be working with our doctor, getting tested, and ensuring that we are in optimal range. The sources of vitamin D, of course, is sunlight. Getting out in the sunlight is very important, but remember sunscreen, wearing clothes, the time of sun exposure, the time of day, darker skin tones, winter seasons, as well as living in the northern and southern latitudes impact the ability of synthesizing vitamin D in the skin. The optimal time for vitamin D production in the skin is around 12 noon. And if you're a lighter skin individual, 15 to 20 minutes may be sufficient for you. However, darker toned skin persons may need a 1 hour to 1.5 hours of sun exposure. Windows block UVB light. And so if you're sitting in a sunny office all day, in your home, in a sunny home or part of your house, you're not getting vitamin D synthesis. And vitamin D synthesis in the skin decreases as we age. So make sure you're looking after the elderly. Make sure that their levels are optimal. Now, we can also get vitamin D in the foods that we eat. This is particularly on the lower end of vitamin D, but nonetheless, we can get it from fish, particularly fatty fish. We can get it from egg yolks, fortified foods, as well as some mushrooms. Now, vitamin D, oftentimes, to obtain and maintain optimal levels, we would need to supplement. And again, before you start supplementing, get your vitamin D levels checked and work with your doctor to figure out the dose. I will say that you will find that most sources will say the upper limit in terms of supplementing is 4,000 international units. However, according to the Endocrine Society, individuals with deficiencies may need 10,000 international units, or even slightly higher, to work their way out of that insufficiency or deficiency. Okay. But I'm not going to tell you what you should be supplementing the amount. You need to, we all, me included, need to get our levels tested and work with our doctor to make sure that what we are taking is not too little and it's not too much. So, hopefully this was helpful to all of you. One more thing I would like to say, I don't think I mentioned that because it is a fat soluble vitamin or hormone, I should say vitamin D, our supplements should be taken with fatty foods. For example, like an olive oil or anything with fat, avocados, a fatty fish, um, and that will help with absorption. So hopefully this was helpful to all of you. Be blessed, and I will see you the next time.